Good morning and welcome to our info sections for the Health Informatics and Data Science program. I'm Jing Peng, the HIDS program coordinator. Today's our agendas include, next slide. An overview of the HIDS program by our program director, Dr. Yuri Gassif. An example of course curriculums also presented by Dr. Gassif. An overview of the capstone project provided by our director of capstone programs, Adil Anarid. An overview of the alumni success stories and the application process by program coordinator and instructor Krivika Bhuvaneshwar. At the end of the meeting, we will be happy to answer your questions. Dr. Gassif, please proceed.
Thank you, Jean. Good morning and welcome to our information session. I'm going to talk about our program and give you an overview of the curriculum of the program, the faculty, and we'll then stop and answer your questions in case you have some. So first of all, I just want to mention that our program was built on the foundation of over a decade of research experience at Innovation Center for Biomedical Informatics at Georgetown University. All core faculty of the program who are teaching in this program are faculty at ICBI and actively doing research and development of new methodologies and tools, computational tools, and do a lot of collaborative projects with other university departments and with other organizations. Innovation Center for Biomedical Informatics is really a hub for cutting-edge research in biomedical informatics. And we apply data science methods and tools to advance precision medicine and clinical informatics. We also part of biomedical informatics shared resource where we provide our expertise as service to a research community at university and outside of the university, where we focusing mostly on providing data analysis for different kinds of genomic related and clinical research, mostly focusing on cancer because we collaborate a lot with our Lombardi Cancer Center, but also with some other departments. Let me just briefly introduce the topic of health informatics to you. What is health informatics and data science? According to American Medical Informatics Association, biomedical health informatics applies principles of computer and information science to the advancement of life sciences research and health professional training and education, public health and patient care, of course. Health informatics is a science of how to use data, information, and knowledge to improve human health. Health data science is an emerging kind of a more new field that incorporates health informatics, data science, predictive analytics, artificial intelligence, and computational modeling to explore and utilize massive amount of data from clinical trials, electronic medical records, genomics, medical imaging technologies, epidemiology, and environmental health. One of the important aspects of health informatics and data science, an emerging technology which is becoming more and more important and visible, is predictive analytics, including artificial intelligence and machine learning. They're becoming a fundamental building blocks for any modern healthcare organization. We actually spend a lot of time in this program training and preparing our students to be able to utilize methodology and tools of AI and machine learning in clinical informatics practice. Why we decided to organize this program? Well, for two reasons. First of all, we are practitioners of health informatics and data science, so we teach what we do in our real lives, but also there's a lot of compelling reasons. For example, 30% of world warehouses data right now coming from health care industry. Informatics market size is expected to hit $100 billion by 2030, and it's poised to grow at 12% rate, annual rate, during this decade. And average annual pay is quite high for data scientists in the United States, and there is a lot of demand, growing demand, on health informatics and data science professionals. This year, we noticed that there was about 50,000 open position jobs posted on Indeed.com, which are all related to health informatics and data science. Another important thing I want to mention is that we believe that our program has some unique features. We organized and created this program with major focus on hands-on experience. Real-world projects experience in a classroom is very important. We believe you can teach and you can learn better if students have opportunity to have a hands-on experience. And more than 50% of all our courses include hands-on demonstrations, exercises, homework, and projects, including capstone project with real exposure to real live data through industry and government agency partners. Our course is taught by well-respected experts in the field of biomedical informatics. Our faculty are practitioners and leaders in the field of health informatics. We offer some flexibility with our program. It's a one-year accelerated program, but we allow also to enroll part-time for 2 or 3 years. We believe our location, of course, ideal. We're located like in the heart of the national capital, Washington, D.C., Georgetown district. And Georgetown and Washington, D.C. is a home to numerous federal agencies, NIH, NCI, FDA, National Institute of Standards, and more than 2,000 biotechnology and informatic management companies which are surrounding Washington, D.C. area. We also provide multidisciplinary experience in a coursework for students. We utilize this rich resource, faculty and experts available at Georgetown University. We have a lot of invited speakers from other departments of university, such as Massive Data Institute, McDonough School of Business, and others. Just give you a brief overview of curriculum. First of all, it's important, especially for international students, to know that Georgetown HIDS program is a STEM-based program, and that it satisfies the visa requirements as a STEM-based program. And our curriculum for 1 year full-time students looks like this. We have 4 courses in the fall and 4 courses in the spring, and 1 final course also. It's a form of internship, mandatory capstone in the summer. In the fall, we teach fundamentals courses, which introduce students and teach them very important skills on massive health data management in a cloud environment with HIDS 501, how to utilize databases, electronic medical records, patient records in HIDS 502. Precision health informatics is about how to utilize genomic data in conjunction with clinical information to provide a better diagnostics and treatment for patients based on their unique individual molecular profiles. And evidence-based data analysis in population health is essentially a biostatistic introductory course, which teaches students how to design the data analysis workflow in a proper way, how to apply a proper statistical tools to provide a reproducibility of the results of data analysis, and generally also utilizing R language, as well as HIDS 503, by the way, to learn how to manipulate data and do analysis programmatically. In the spring semester, we have more advanced courses, which in a way, the continuation of courses taught in the fall. Advanced health topics in health informatics is all about large-scale health information technology and data management in the cloud. AI for health application, the course focusing entirely on methodology and tools and examples of artificial intelligence and machine learning application in various areas of biomedical research and technology. Digital health application will allow students to learn how to develop their own mobile apps for patient-based information, and imaging informatics is all about data analytics approach, how to analyze medical imaging data, such as MRI, CAT scan, digital pathology, and such. And mandatory capstone, we're going to talk more about in the second half of our presentation. It's a very important final step for the program, where students will work with our industry partners in real life projects over 2 months and present the results for the program. There are some hidden connections and overarching topics in this program which I'd like to highlight. If you think about how the courses in the second semester connected to the first semester, there is a connection between HIDS 501 and HIDS 506, because it's the same course director and faculty, Dr. Gupta, who is teaching both courses, and his major focus will be on AI and machine learning application and big data management in a cloud environment. HIDS 502 is all about medical records, databases of clinical information, and HIDS 505 is a natural continuation of this project. Our precision health course, HIDS 503, has an unexpected continuation in HIDS 509 on imaging data for precision medicine, because the imaging data these days are being approached by data analytics methods as continuation of the same idea of customizing diagnostics of the patients based on their imaging data in addition to molecular data. And HIDS 502 also has an interesting connection to HIDS 507, because one of the faculty who teach electronic medical records utilization also teaches HIDS 507 with health application development and human factor engineering, a very interesting additional topic covered in HIDS 507. And one most important overarching topic, which we start to cover even in the fall with application of artificial intelligence and machine learning in biomedicine. In the fall, we talk about specific examples to get students to see what is available and possible to do with AI and machine learning application in this field. So 3 different courses actually present students with examples, but actually in-depth training in AI and machine learning continues in the spring semester in HIDS 506, as I already mentioned. And also in image analysis course, where most of the course is actually focusing on advanced application of artificial intelligence for image analysis in biomedical field. One of the examples of our research in this field, many faculty in ICBI are involved in AI and machine learning application biomedical projects. And just last week, 4 of the faculty of this program, who are also member of ICBI, co-author on this very large, high-profile publication published in Nature Communications, the top journal in biomedical field. It's all about federated learning approach, and it's a work of a very large international consortium of different organizations led by University of Pennsylvania and Intel Corporation. And it's a unique study which allowed to train the artificial intelligence models on the data without really sharing data. It's a really unique approach called federated learning, and we got a very decent coverage in the news last week. Even Intel newsroom devoted a video and a news article about this publication, where they actually pointed out that this is the largest today known medical federation learning study, and it's utilizing MRI scans of brain tumors from over 6,000 patients. And the only reason why we were able to utilize so many patient data, because they were available through this consortium network of different organizations, where they develop a common model and train the model on each of the individual data sets, so that the model actually utilizes knowledge from over 6,000 patients. But only the model was shared. The data actually was staying in each of the institutions. It's very interesting. And this is just another coverage in the news about the same. highlighting that these results actually deliver a very interesting improvement on glioblastoma diagnosis using MRI scans. We reported about 30% increase in accuracy of determining the boundaries of the tumor in the brain. It's very important in preparation for the surgery to know exact boundaries of the tumor in the brain. Our HIDS core faculty and staff are all ICBI faculty listed here. Many of us have experience in different biomedical research and technology development. Now his affiliated faculty are representative of different very well-known companies such as Pfizer, AstraZeneca, and MedStar Health. Our group of faculty collaborating with us and teaching in this program are all MedStar faculty. They are MD medical doctors who are also certified, trained informaticians. So they have combined in their clinical practice their medical knowledge and information knowledge, and they share this wealth of experience with students through several courses in a program. So I'm going to stop sharing at this point and have a pause, and maybe some of you have any questions for me, and then we will proceed with HIDS capstone presentation. Any questions? We also will have opportunity for you to ask additional questions at the end of the session. And also, please notice that we posted in a chat all the links to information about the program, ICBI, and all useful links which you can use to learn more about the program. If there is no other questions, then Professor Alawi, please go ahead with your presentation.
Thank you, Dr. Gusev. Thank you, and welcome, students or potential students to this session. I think this is a great step forward that you're interested in this kind of programs, and we really encourage, you're looking forward. And I will talk a little bit about the HIDS capstone program. And as Dr. Gusev mentioned, the whole program is industry-driven. So what that means is we have a board of advisors from industry who are leaders and pioneers in the domain of health informatics, data science, from different leading companies that advise us on what kind of skills are needed in the marketplace. So these students are prepared, or our students are prepared to join forces as soon as they complete the program. And we will give you some examples of those. So the capstone program is, of course, a key pillar of the program. It is a full 3 months, full semester, where students are put in companies or agencies, government agencies, working on word problem, coming up with solutions, and working with mentors from the company and a mentor from the Georgetown faculty. The aim or the goal of these programs is to prepare students to be working in a real-world environment, coming up with solutions, identifying the problems, and going through the whole life cycle of health informatics or data science solution. There are a wide variety of topics that are covered. So the process is, it is a multidisciplinary in nature. So, students are not only working on a technical problem, but also understanding the problems, presenting, communication, leadership. So they are in charge of their program or their projects, but we have guidance from the industry mentor and Georgetown faculty, as I mentioned. And the main purpose is to apply what have been learned during the whole year in this and apply them to this program, in this capstone. The requirement, actually what we do, the way that we do it is we get requests from different partnering companies, and you see some of them here, for students to work with them on these capstone programs. And within the HIDS faculty or leadership program, leadership, we identify the projects that will benefit our students, that will make them successful, that apply all their knowledge that they have acquired during the year. So at the end, they have an additional learning, they have hands-on experience, and they can join forces. As you see here, this is a list representative of some of the collaborators and partners, both from industry and government agencies. Those are companies that submit different projects to us for our capstone program. I will not go through each one of these, but these are some examples of previous projects that our students completed. And from here, and as you know, if you remember from Dr. Gusev's presentation, we deal with a wide range of topics, from data, from molecular to population health, and everything in between. So our students at the end of the program, or for the capstone, they have a lot of choices to pursue, whether it's precision medicine, whether it's population health, socioeconomic factors, to readmit, or social determinants of health, and so on. And just quickly from this list here, you can see some of the projects. For example, the first one with MedStar Health, which is our clinical partner, with 10 hospitals in the region. So our students worked on a project to define what are the socioeconomic factors that impact readmission after major surgery, cancer surgery. This is an opportunity to work on real data from a large health network and doing predictions based on data that is actually not in the healthcare institution, meaning this is coming from Census Bureau or Environment Health or others. So this can give you like an example of the variety or the scope of the work that has been done. Others, you can see Frederick National Labs, which is one of the most prominent national labs in the nation. AstraZeneca is a leading drug development company. In Bete, one is our students built some solutions that are actually embedded in their product, and this is for doing molecular profiling of two patients' reports. So it's not only to hospitals or clinics, but patients receive those reports, and that has been included in their patient portal, if you will. Next slide, please. This is another example, continuation of examples that our students worked on. Again, AstraZeneca, guiding or defining using AI models and machine learning tools, how can they retain patients in clinical trials, for example, and how to avoid attritions from these patients or that are enrolled in clinical trials, because clinical trials, 80% of the clinical trials fail because of patient attrition. FDA's projects, we had again very successful projects with them. MedStar again, ICF, which is one of the large contractors for the government agencies, dealing not only with healthcare but also with the Department of Defense and so on. So we had a couple interesting projects looking into mental health data commons. So how do you build an ecosystem that can inform the mental health status and what kind of suicide rates within the nation, how to avoid them. So these are impactful projects that are real problems that students work on to develop solutions. And as you may have seen, some of them go into real solutions, others end up as publications in scientific journals or papers, and others are continuing to be worked on. Next slide, please. So all these from the education that students receive during the 2 semesters, the capstone projects, what students bring as their previous skills and experiences. They are prepared for many opportunities that you can see a list, just an example list here, from clinical informaticians, data scientists working leading positions within different institutions, whether healthcare, whether agency, federal agencies or government agencies, research, and our students who graduated are now into multiple programs, multiple institutions. Some of them actually were retained by their capstone, the companies that hosted their capstone projects. I will pause here, see if you have any questions.
Okay, I think we can move on. Yeah. Thank you, Adil.
Thank you.
Hi, everyone. This is Kritika. I'm the curriculum coordinator, and I will go over some details about our alumni and the application process. So if you go to tinyurl.com/GUHIDS-alum, we have spotlighted many of our alumni, and you can see what career paths they have taken. Many of them have gone into industry. We have our students going into academia, government, consulting agencies. We also have one of our students who are trying to pursue a PhD program, etc. So that the link is tinyurl.com/GUHIDS-alum. You can see various student spotlights, and here is information about what kind of capstone projects our students took and where they are right now, what kind of jobs they are taken on. You can see more details here in the same link. I'm going to go over some of the application process. We have 2 deadlines, a priority deadline, which is May 15th. We do encourage applicants to submit their application by this early date to be eligible for scholarship applications. And we have a final deadline on July 1st. A typical applicant who applies to our program comes from various degrees. They can have a degree in nursing and biology, or engineering and medicine, or computer science, data science, bioinformatics, statistics, math, etc. We do get applications from students who have just graduated from their undergrad degree, or professionals who are in their early career and are interested in upgrading their career to the next stage. We ask applicants to have some background in programming and quantitative sciences, and I will go over that in a minute. Our applicants can work well in groups and also by themselves, and they're eager to learn new skills. In the next slide, I have so this is what we ask for documentation of programming experience. We ask applicants to demonstrate some knowledge in R, Python, or SQL, and we accept certificates from massive open online courses like EDX, Coursera, DataCamp, Udemy, etc., or a GitHub page where you showcase your project-based code to demonstrate your competency in the programming language, or project-based examples with programming experience. This is the application process. We first ask applicants to gather these documents: a 4-year bachelor degree certificate, copies of official transcript from undergrad and/or graduate institutions, 2 letters of recommendation, statement of purpose, application fees. GRE scores are not required, and TOEFL scores are only required if the undergrad institution of education, the language was not in English. And documentation of programming experience, as I just mentioned. Once you gather your documents, you would go online to our website and complete the online application form. You would pay the application fees. Then the application would be submitted to our group. The candidates shortlisted and who satisfy the requirements will be contacted for an interview, which is a 30-minute Zoom-based interview, a face-to-face interview, and within 2 weeks after the interview, the applicant will receive a final decision. And you would log back into the application portal to see the decision. And then applicants would get up to 4 weeks to pay the deposit and secure a seat in the program. So this is our website. This is how you start your application form. You go to tinyurl.com/GUHIDS. You go to how to apply. You click on that, and that will go to an application checklist, which has a link to the online application form. The first time you would click on the link on the right side to create an account and start the application process. Once you can always save it and come back at any time. At that point, you click on the left side where you can log in and continue the application form. Please connect with us, stay in touch. You can join our mailing list. You will go to our website and go to contact us, and this is where you can get more information. We do send emails about information sessions and news from our program. Please follow us on LinkedIn. tinyurl.com/HIDS LinkedIn, where we post about faculty, about our industry, about our students, and also research work from our faculty and mentors. We have a YouTube channel where we have short videos about our program and recordings of information sessions and also webinars from faculty showcasing their research. The link is tinyurl.com/HIDS YouTube. Please email us at any time, hids@georgetown.edu, and we're happy to help answer any questions or help you with the application process. And these are the main important links, and you also have them on the chat box. I'm going to pause here and see if there are any questions.
Hi. Thank you